Hello everyone. So most of us have been facing patients that have dry eye syndrome, and we start treating them starting with eye drops, lubricant eye drops, or if they have Meibomian gland dysfunction, we start to teach them how to do the specific lead hygiene and doing the warm compression, expressing the Meibomian glands. And sometimes we send the patient to do the IPL therapy, which is intense pulse light therapy, which help a lot as well in improving the Meibomian gland secretions and the oily layer of the tear film. However, the question today in this video, either this IPL therapy is always safe on the cornea, could it make a complication in the cornea as well? This question will be answered in this video today. This is Dr. Hosny. I'm a consultant ophthalmic surgeon in London with a special interest in cornea, anterior segment, and cataract surgeries, and you are watching now the SeeLife podcast. Before starting to explain today's case, we need to have a simplified introduction about what is the dry eye and what is the tear film is. So, as we can see here, the tear film is not only made of fluid, aqueous, it's actually made of mucus and aqueous and a lipid layer, like an oily layer, which protect the surface of the tear film from being evaporized during the day. And this oily secretion is coming out from the Meibomian glands, which are the glands are near to the eyelashes, and its secretion actually protects the tear film from having evaporization. As well, if we can see the Meibomian glands, if they are healthy, everything looks good. But if it's clogged or blocked for any reason, due to inflammation, due to any other reason, it just affect the secretion of the oily layer, and as well can make some cysts and inflammation. The IPL therapy is producing a pulsed light while covering the patient's eyes to protect the eye globe itself. This pulse light actually improves the circulation around the Meibomian gland and improves the secretions of the oily part of the tear film. And this actually, by its own, it just restore the oil flow and improve the symptoms of the dry eye. So this patient we are talking about today, she is 48 years old. She has a history of bilateral LASIK surgery before. And as we know, the LASIK can contribute to dry eye as well by affecting the cornea sensation, which usually should improve within 6 months to 1 year after the LASIK surgery. However, after she had her IPL done in one of the centers abroad, 2 days after this, she developed pain in both eyes and irritation and grittiness. And on examination, we find that she had bilateral inferior corneal epithelial defect, which kind of looked like suspicious to be viral origin, but still it's happening after the IPL, 2 days after the IPL, and it happened in both eyes all of a sudden with no history of any viral infection before. So we start to treat the patient actually to treat this epithelial defect. We treat her with antibiotics, steroids, and cyclosporins, which actually doesn't work well. So we added the serum drops as well. And after that, we had to do amniotic membrane transplant. Then in a period of 4 months, everything had been improved. So her vision improved from 6.24 to 6.7.5 in the right eye and 6 over 6 in the left eye after being 6 over 12. So still we have this question, why this happened with the patient? Like she did her IPL in a very well-recognized place in Spain, and she was having the protection goggles. What happened and what we think, both of us in our center and the Spanish center, if you see here in the photo, the patient have an eyeliner, which is actually a tattoo eyeliner. And this tattoo has got this kind of pigments, and this pigments is a chromophore pigments that change the light energy into thermal energy. And this thermal energy can be still emitting few days after the therapy. And we think that this pigments and the emission of thermal energy causes this thermal burn that happen in both corneas and causes this issue with the patient. So thanks God now the patient is much better. However, she has some irritation even with the good vision. So we treat it with the lubricant drops and some cyclosporin drops. And even the center in Spain as well was adding for her losartan, which we don't have still in most of our centers in the UK because this was improving a little bit of the faint scar that was developing. What we learned from this case that now if we are about to do an IPL therapy for any patient, we need to check the eye well. Even we need to be specifically searching if the patient having an eyeliner tattoo, which can cause some complication as we have in this case. So if you are a surgeon that use IPL therapy frequently in your practice, we'll be very happy to know from you about what's the other complications that you can see from the IPL, and did you notice such a case that the tattoo for the eyelid margin caused this kind of complication? Please write this in the comments so we all learn from each other. As we always say that these videos and these scientific materials is not only for discussion and for learning, but our main aim is to help people to see life again. And if you like this video, please press like and subscribe in the channel and share it with your colleagues so we all benefit from each other. Thank you very much and see you next time.